One last point, which is maybe less contentious, but maybe even more complex, is healthcare. Yeah. And you have established a partnership with Amazon and with Berkshire Hathaway in an attempt to reduce healthcare costs. But there's a lot of discussion about the price of pharmaceuticals, of drugs, and so on. But that's only about 8 to 10% of our healthcare costs. Yeah. What are your priorities, and how are you tackling?
When I listed the series of issues facing the United States, that's one of them. It's now 18.5% of GDP. Our average developed world is 9%. So as a competitive thing, now, of course, if you get better health, it's a good thing. And so I don't want to act like we have great health systems and hospitals and pharmaceuticals. And you're right, the pharmaceutical we talk about, but it's 10% of the problem. But here are the problems. End of life, it's like 15%. It should be half of that. Fraud and administrative costs, like 25 or 30%. They should be half of that. Drugs are underused and overused. As it turns out, we all put in high deductibles. You know, we thought we were getting people skin in the game. They go shopping more. They don't shop. I mean, I can ask you all get blood tests and MRIs or CAT scans, whatever. You have no idea what they cost, and you never asked. Doesn't matter if you have a deductible. And you can't go on your phone and get it. There's no transparency either, even though now hospitals, are supposed to be publishing those things, but they're almost impossible to read. And then, wellness. I mean, 40%, I think 40% of our healthcare costs are related to obesity. And obesity drives cancer, diabetes, heart disease, stroke, depression. And you think we'd be teaching education, nutrition, and some, like just walk a little bit to kids in high school and grammar schools. And I was a kid, I remember President Kennedy put in that, I forgot what it was called, but we all were running 660s and all doing push-ups and pull-ups. And we got to get back to like common sense stuff. And then get rid of the inefficiencies with data, transparency, analytics. And there are 40 million uninsured. So I think we should have we need to have universal coverage in the right way for Americans. So even the 40 million uninsured have access to your emergency rooms. So it's not that they can't get medicine, they just get it the worst way. That visit is $10,000. A little bit of prevention is $1,000. And so there's so many things we can fix. And so this health thing is Amazon, Berkshire, JP Morgan. We got staying power. We've hired some great people. We're going to take the long-term view. We're going to figure out how to attack this problem using data and analytics, and we haven't decided how to do that yet. As you know, it's extremely complex. And anyone who wants to help, we're not trying to do this against it. Ours is a not-for-profit thing. We want better outcomes for our people. We think we can save a lot of lives fixing what I just talked about at our own company. Diabetes, we have. Now the wellness programs we do the actuaries tell me it's saving 50 to 75 lives a year because people find out that they have high blood pressure. They could drop dead from, or walking diabetes, they could drop dead from. And so all these things, we just have to do a better job. And it's going to take a while to fix it, and it needs to be sustained. The thing about Obamacare is it didn't fix the fundamental problems. It just added people to them. And so we just got to kind of go back and say, how can we do a great job for the American citizen, fixing the problems, and it's not against anybody.
We could go on and on, but somebody's just pointed out that we've run out of time. So, Jamie, thank you so much for coming and for being so candid and sharing your
You're welcome. Thank you very much.